to deal with the difficulties of maternal health. It could solve any one of a number of other health problems in the same country. So you really get a twofer.
Right. It's almost an umbrella issue, isn't it?
Exactly.
So, right.
Exactly.
Christy, I'm bringing you back in here.
Ethiopia.
Go ahead.
Sure. I just wanted to say that Ethiopia actually is, to answer the person who sent the question, Ethiopia is one of those countries that it's one of the top 11 countries with the highest rates of maternal mortality, but they are having an amazing effect with a government-led health extension worker program. They've trained more than 30,000 health extension workers around the country. And so this is an example. This is a country that's doing something incredibly effectively and could serve to model for other countries nearby.
Well, Christy, I wanted to touch on your documentary, No Woman, No Cry, where you travel to Tanzania and you follow a young woman called Janet during the last dangerous moments of her pregnancy. There's a moment during your filming where you managed to capture the fragility of life in the face of poverty. We'll take a look at that.
Sasa mume wako hajaja mpaka saa hizi itakuwaje? Ili aweze kukusaidia kwa ajili ya kupata usafiri wa kukusafirisha Mount Meru.
Ampigia simu.
Maanake sasa kama itakuwa hivyo, sasa sisi tutakupelekaje basi Mount Meru? Maanake ni lazima upate gari uende naye kutokana na hii hali ulionayo. Una hela ya kwa ajili ya kwenda hospitali? Kabisa.
Christy, there we have the simple problem, the simple issue, but obviously potentially fatal issue of a woman trying to get to hospital from a rural area. Tell me about that incident, also how that must be a fairly common problem for a lot of women in that kind of environment.
Absolutely. Transport remains one of the biggest obstacles or barriers to care for women. That particular area of Tanzania, in northern Tanzania, we were 35 kilometers from the hospital. In some countries, it's much, much further. But here she was, she hadn't eaten in 24 hours. She had no money for transport, and she was being told by the clinic, who was unable to handle her situation, that she had to be transported and referred to the nearest hospital, which was 35 kilometers away. Had we not been there, I don't know what the outcome would have been for Janet. And we found this day in and day out, where we filmed all over the world, the same problem. And so I walked away from the experience of thinking, if we don't get beyond this transport predicament, which is why these healthcare workers going into the communities is going to be such a huge piece of finding the solutions.
And Christy, of course, Jill had mentioned earlier about how women do a lot of the work, and in a place like Tanzania, for someone like Janet, that is the case. I wonder how much there is an effort to try to emphasize that women are so much a part of the economic environment there too.
Absolutely. I mean, we saw her in those final days of her pregnancy. Her workload did not change one bit. I mean, here in the West, we're often given the encouragement to rest during our pregnancies, to take time off of work. That's not the case for so many women around the world. And Janet being one of them, she worked up until the last moment of you know, where you see her in the scene.
Jill, why do women remain victims in this kind of environment? Is it an economic thing, an economic empowerment issue, or a political empowerment issue?
It's probably some of both. I think that people don't really recognize the important role women do play in the economic life of not just the family, but the country. But what we've struggled with for decades is the political will issue. It simply hasn't been there. And honestly, when we talked about social justice issues, we got a lot of sympathy, but not a lot of action. And so once we began to talk about the economic implications of all these women dying, both the cost to the health system, but the cost to the economy, things began to change.
Christy, I'm going to put an email to you if I can. It came in from Uganda. It touches on a key factor, which is, you know, it's the role of men. And Arthur Musasizi in Kampala in Uganda wrote in saying, without mothers, this world would not exist. We as men have a collective responsibility to respect women and give them the necessary support they need to bring up a new generation that will inherit this world when we are long gone. I wonder how much, or is there enough effort made to bring men on board with trying to resolve this issue?
I think men are absolutely a piece of the solution to this. I've seen in many, many countries amazing community-based programs where they invite the men in, and where religious leaders in their communities take this on. They're educated, and then they become the voice of the community to help bring men and families around this issue. It can be incredibly, incredibly impactful. I mean, in our film, oftentimes the men just were not there. They just weren't. And people ask me, did you try to exclude the men? And I said, no, we filmed what we saw. They just weren't there. So I think really, starting with young children to understand that both men and women, boys and girls, have a role to play in making this better.
Right. Jill, an email to you then from Bangladesh, from Aziza Haq, who says, raising women's status in the family and society is most important to safeguard them from premature death, either from pregnancy or any other social injustice. What can be done to raise their status in the family?
It's tied to raising their status, period, recognizing the values they bring. It's one of the reasons we have just published our Women Deliver 100 list, because it was trying to elevate, to give real visibility to people who are doing things that help girls and women. And it's just an important opportunity to take the 100th anniversary of International Women's Day to focus on how important, how integral women are to the life of our communities.
Well, Christy, talking about this issue, I wonder if you're a fan of the micro loan system that that is out there and helping a lot of women in poor areas, in rural areas especially. I don't know, in your travels, what you saw of the impact that might have in raising the economic empowerment of women, and as a result, their sort of social empowerment.
I very much believe in the microfinance model, and seeing where that model can be connected to health systems, I think is key. We saw that in Bangladesh, obviously being sort of the foundation for most microfinance programs. Incredible programs where the first thing the woman does when she does have a bit of financial empowerment is to take care of the health of herself and her family. And so it's so clear that this is such a critical and important link.
It's interesting you touch on that. I put an email to you, Christy, that came in from someone who says they traveled with you in Bangladesh during your time there on the documentary. And it's Mika Ahmed from Bangladesh, who says,
oh,
you remember? Okay, well, he says,
yes, I do.
Well, in a country like Bangladesh, mothers will generally choose to provide the best food to their husband and children, saving only vegetables and rice for themselves. Villagers will rarely visit a doctor until their health gets very bad. What can be done to reduce maternal mortality as a cause of poor health? And I know that level of sacrifice by mothers is incredibly touching. I know Bangladesh also has that unique problem of the pressure many women feel to have their children at home and not go out to clinics and so on. And I wonder, what was your impression of that situation, and what can help make women there, pregnant women there, more safe?
Absolutely. I mean, we saw in Bangladesh in so many circumstances where, this is where almost 80% of women deliver outside of a facility. So trying to really understand why women are making that choice, and you find out that actually they're not making that choice at all. Those choices are being made by others. I think seeing also how there was, just the not knowing that if you were to eat well every day, that your baby would be healthier. There was a sense that people didn't want their babies to grow too big. There was a lot of education that needed to be provided, and we saw a great program in the Manoshi program, that's a BRAC program there in Bangladesh. It's fascinating to see how different and how similar this experience is for so many women around the world. But I did find in Bangladesh to be completely in awe by the strength of the women. There were women that were actually in labor, I mean, hardcore labor, and you would not even